Hello everyone. Welcome to Health 999, your go-to channel for valuable health information. Today, we will explore 10 warning signs of stroke in the elderly. Stroke is one of the leading causes of death and disability, especially among older adults. Recognizing early symptoms can help save lives and minimize severe consequences. Stay tuned. 1. Sudden numbness or weakness on one side of the body. This is one of the most common and dangerous signs of a stroke. When an elderly person suddenly experiences numbness or weakness on one side of their body, it means they may lose control of one arm, one leg, or one side of their face. This usually happens very quickly, within seconds or minutes. The patient may not feel pain but will have difficulty moving. To check, ask them to raise both arms. If one arm cannot be lifted or drops quickly, this is a serious sign. Similarly, if one leg becomes weak, the person may be unable to stand steadily, stumble, or even fall. Observe whether they can grasp objects. If their hand suddenly weakens, they will be unable to hold items securely. Additionally, their face may also be affected. One side of the face may droop, making it difficult to smile or chew. Upon closer observation, you will notice an obvious imbalance between the two sides of the face. If in doubt, ask them to smile. If their mouth appears lopsided, this is a sign that requires immediate medical attention. This symptom occurs because the blood supply to a part of the brain is blocked or a blood vessel has ruptured, depriving brain cells of oxygen and causing them to die rapidly. If not treated in time, this condition can lead to severe complications, resulting in loss of movement ability or even death. If you notice this sign, do not wait to see if the symptoms improve. Every passing minute, millions of brain cells can be permanently damaged. Call 911 immediately and get the patient to the hospital as soon as possible. While waiting for emergency services, keep the patient in a lying position on their side and do not allow them to move on their own, as this could worsen their condition. 2. Difficulty speaking or slurred speech. One of the most common signs of a stroke is difficulty speaking or slurred speech. The patient may suddenly lose the ability to express their thoughts, develop a lisp, or be unable to pronounce simple words correctly. They may struggle to find the right words or fail to understand what others are saying. This occurs because the part of the brain responsible for language has been affected. If you notice an elderly person suddenly slurring their speech or having trouble articulating words, perform a quick test by asking them to repeat a simple sentence such as, "The weather is nice today," or "My name is." If they cannot say it clearly or their voice sounds distorted, this could be a warning sign of a stroke. Another way to check is by asking them to write a simple sentence. If their handwriting is shaky, difficult to read, or they seem to forget how to write, this is also concerning. Speech difficulties may be accompanied by other symptoms such as facial drooping, weakness in one side of the body, confusion, or temporary loss of consciousness. If you suspect a loved one is experiencing these symptoms, do not hesitate. Call emergency services immediately. Time is the most critical factor in stroke treatment. The sooner medical intervention occurs, the better the chances of recovery. In some cases, the person may experience temporary speech difficulty and recover within minutes or hours. However, this does not mean they are safe. It could indicate a transient ischemic attack, TIA, also known as a mini-stroke. If left untreated, it could lead to a more severe stroke in the future. Always remember the FAST rule for stroke recognition. Face: is the face drooping? Arms: can they raise both arms? Speech: is their speech clear? Time: if there are any signs, call emergency services immediately. Never ignore slurred speech or difficulty speaking, as this may be an early warning of a life-threatening stroke. 3. Facial drooping. Facial drooping is one of the most common signs of a stroke. When a stroke occurs, the nerves that control facial muscles may be affected, causing weakness or loss of control on one side of the face. This results in the mouth drooping to one side, difficulty smiling, trouble speaking, or even uncontrollable drooling. To check for this sign, ask the person to smile or say a simple sentence. If one side of their mouth does not lift normally or appears visibly uneven, this is a warning sign. The person may also experience difficulty chewing or swallowing food, making them more prone to choking. In addition to facial drooping, some individuals may feel numbness or loss of sensation on one side of the face. This occurs when nerve damage reduces the ability to control facial muscles. Some may also experience drooping eyelids or difficulty opening and closing their eyes normally. If you notice a sudden onset of facial drooping in a loved one, do not take it lightly. Check for other symptoms such as slurred speech, weakness in the arms or legs, or loss of balance. If 2 or more signs are present, call 911 immediately. Time is crucial in stroke treatment. If medical help is received within the first 3 to 4 hours, the chances of recovery are significantly higher. 4. Loss of balance, dizziness. One of the most noticeable signs of a potential stroke in elderly people is sudden loss of balance and dizziness. This is a warning sign that should not be ignored, as it indicates that blood flow to the brain may be impaired, directly affecting the body's ability to maintain balance. Dizziness is the sensation that everything around you is spinning or that you are losing orientation. A person experiencing dizziness may feel as though they cannot stand steadily or may stagger and sway while walking. This condition may last only a few seconds or minutes, but if it persists or recurs frequently throughout the day, it is important to pay close attention. Loss of balance occurs when an elderly person cannot maintain a steady stance and feels as if they are leaning to one side or cannot walk properly. They may feel like they are being pushed to one side or that the floor is tilting. These symptoms often appear suddenly and may be accompanied by other signs such as numbness in the hands, legs, or slurred speech. The cause of this condition could be due to an abnormal change in blood flow to the brain. When the brain doesn't receive enough oxygen and nutrients from the blood, the areas of the brain responsible for body control, such as those that regulate balance, can be affected, leading to dizziness and loss of balance. If an elderly person experiences dizziness along with balance loss, they may have difficulty performing everyday activities like walking, standing up, or sitting down, which can also pose a higher risk of falling. This not only affects their health but also poses a life-threatening risk, especially since falls can lead to serious injuries like fractures, head trauma, or back injuries. One simple way to check for balance loss is to ask the elderly person to stand upright and close their eyes for a few seconds. If they feel unstable or have difficulty maintaining balance, this could be a sign of poor blood circulation or other stroke-related issues. Another simple test is to ask them to walk a few steps and see if they have difficulty or feel unsteady while moving. If dizziness and loss of balance persist, do not hesitate to take your loved one to a doctor for a thorough checkup. Tests such as blood pressure measurement, heart rate monitoring, and even imaging tests to examine the condition of brain blood vessels can help identify the exact cause. Do not overlook any symptoms related to dizziness and loss of balance. Especially for the elderly, these signs may be a warning of a stroke, and if not addressed promptly, the consequences could be severe. 5. Sudden severe headache with no clear cause. Headaches are a common symptom that most of us have experienced at some point. However, there are headaches that come on suddenly and are so severe that they prevent us from continuing our daily activities. Particularly, if the headache is unlike the usual ones, appearing unexpectedly without a clear reason, it could be a warning sign of a stroke. For the elderly, a sudden and severe headache, feeling like the head is splitting open or experiencing intense pressure in the brain, is one of the signs that should be paid special attention to. This could indicate that a blood vessel in the brain has ruptured, causing a brain hemorrhage. Alternatively, it could be a sign of a mild stroke, when a blood vessel in the brain becomes blocked or there is a temporary disruption in the blood supply to the brain. When an elderly person suddenly experiences this type of headache with no clear cause, especially if the pain feels different from their usual headaches, it should not be ignored. This type of headache may last from a few minutes to several hours, and it is often accompanied by other symptoms such as nausea, dizziness, or even loss of balance. If this headache is accompanied by other symptoms like weakness on one side of the body, slurred speech, or difficulty moving, the likelihood that it is a sign of a stroke becomes higher. A headache with nausea, vomiting, or blurred vision is also a serious warning sign. Moreover, if this headache comes on suddenly without any obvious explanation, such as stress, fatigue, or lack of sleep, it is crucial to seek emergency help immediately. Older adults may not realize that their severe headache is signaling a serious health issue, so family members need to be vigilant and act quickly if they notice these signs. Don't hesitate, as delaying treatment increases the risk of serious brain damage. Every minute that passes without treatment can affect the outcome and recovery of the patient. So, if your elderly loved one suddenly experiences a severe headache with no clear cause, especially if it is accompanied by symptoms such as weakness, difficulty speaking, or vision problems, do not hesitate to call emergency services immediately. Early detection and timely action can save lives and minimize the serious consequences of a stroke. 6. Sudden vision loss or blurred vision. One of the dangerous signs of a stroke, especially for the elderly, is sudden vision loss or blurred vision. This is a sign that should not be ignored, as it could indicate that part of the brain is being deprived of blood flow, leading to damage to critical areas, including those controlling vision. Vision is one of the most important faculties of a person, and when it is lost or impaired, it can create many difficulties in daily life. When an elderly person suddenly experiences blurred vision or is unable to clearly see something right in front of them, it could be a sign of a stroke. This happens because a stroke can affect areas of the brain that control vision, particularly the blood vessels that nourish these brain regions. One common manifestation is temporary vision loss in one eye. The person may feel as if a fog has covered their vision or as though their eye has become cloudy for no apparent reason. In many cases, this condition doesn't last long, but when it occurs, it's a sign that something serious is going on in the body. These symptoms may last for a few minutes or even hours, but if not treated in time, they could result in permanent damage to vision or even total blindness. In addition to blurred vision in one eye, some individuals may experience rapid changes in vision in both eyes. They might feel as though they are seeing through a foggy lens or seeing everything in a blurry, indistinct way, making it difficult to identify faces, objects, or even the path ahead. If you notice that a loved one suddenly has blurred vision or vision loss, especially when combined with other symptoms such as weakness on one side of the body, loss of balance, or difficulty speaking, don't hesitate. This could be one of the warning signs of a stroke. Although this condition may improve temporarily, it still requires immediate medical attention to prevent more serious complications. If sudden vision loss or blurred vision occurs, the first thing to do is stay calm and immediately call emergency services. Only medical professionals can accurately determine the cause and take the necessary steps for treatment. 7. Confusion, difficulty understanding speech. One of the most important signs that family members or caregivers may notice is an unusual change in the elderly person's ability to comprehend and communicate. When a stroke occurs, the brain of the patient is affected, which can lead to confusion. Stroke-induced confusion is not just about forgetting a few details. It can involve the inability to recognize family members, forget daily routines, or fail to perform familiar tasks. A clear sign to recognize is when the patient has difficulty understanding simple questions. For example, if you ask them, "How are you feeling today?" they may not be able to respond clearly, or they might answer incorrectly or not understand the question at all. This shows that the brain is no longer processing information normally, and it could be a sign of a stroke. Additionally, a stroke patient may have trouble expressing themselves. They may start slurring their words, fail to complete sentences, or say unrelated words, making it difficult for others to understand their intentions. This is a particularly important sign because, in some cases, patients may feel embarrassed or confused because they can no longer speak as clearly as before, which can lead to emotional and behavioral changes. Stroke-related confusion can also be accompanied by disorientation. For example, the patient may not recognize the place they are in or may not remember who they are talking to. They may forget recent events or even fail to recognize their closest family members. This confusion can last from a few minutes to several hours, depending on the severity of the stroke. Furthermore, if the patient shows signs of short-term memory loss, such as forgetting basic activities like eating, personal hygiene, or forgetting recent conversations, these could also be signs of a stroke. These individuals may become very anxious because they cannot recall simple, everyday things. When these signs are noticed, it is crucial not to hesitate. Immediate medical intervention is needed. Delaying the response can increase the risk of brain damage and reduce the chances of recovery. Thus, if an elderly person suddenly has difficulty understanding or speaking, it is important to be vigilant and act quickly to ensure their health. Never ignore these symptoms, as timely intervention can improve the situation and help the patient recover better. 8. Unexplained nausea or vomiting. When it comes to strokes, there are many signs and symptoms to watch for, and one often overlooked but very important sign is unexplained nausea or vomiting. This symptom can be not only uncomfortable but also a warning of a serious issue related to the brain, especially when a stroke occurs. When we talk about nausea, most of us can recognize this uncomfortable feeling. However, when nausea becomes a sudden symptom with no clear cause, especially if it is accompanied by vomiting, we need to be cautious. For older adults, this change can happen quickly and severely, particularly if they have never experienced such symptoms before. Nausea or vomiting is not always related to stomach problems. If an elderly person suddenly feels nauseous without any explainable reason, this could indicate a change in the central nervous system. And when nausea is accompanied by other signs such as severe headache, loss of balance, or blurred vision, it could be an indication of an impending stroke. Simply put, when a stroke happens, some areas of the brain are damaged, which can disrupt the functioning of various organs in the body. The digestive system is no exception. As a result, one of the body's responses might be nausea or vomiting. This is the body's mechanism to react to sudden changes in the brain, causing other organs like the stomach to function abnormally. In addition, nausea or vomiting can be a sign of what is called a silent stroke, where the symptoms are not as obvious as those of typical strokes, but the consequences can still be severe. The patient may not feel any immediate pain, but changes in the brain may still be occurring slowly. If an elderly person starts feeling nauseous without any clear reason, and especially if they experience dizziness, loss of balance, or difficulty speaking, you should call emergency services right away. Do not wait, as a delay can increase the risk of brain damage and affect recovery. In cases of prolonged vomiting, it is important to provide enough fluids and ensure the person is in a safe position. However, remember that seeking medical help should be the top priority. If this condition suddenly arises and cannot be explained, immediately call emergency services. Thus, unexplained nausea or vomiting should never be ignored, especially in elderly individuals. When combined with other symptoms such as one-sided paralysis, difficulty speaking, or severe headache, this could be a clear sign of an impending stroke. Act quickly and promptly to ensure the safety of your loved ones. 9. Seizures. Seizures are one of the signs that may occur when an elderly person suffers a stroke. When the brain is deprived of oxygen or blood, the nerve cells can malfunction, leading to seizures. This is a serious sign that should not be ignored. Seizures can take various forms. Some people may only experience mild shaking in their hands or legs, while others may have full-body convulsions, with uncontrolled movements throughout the body. In some cases, the person may fall to the ground, and their entire body will contract, accompanied by muscle spasms. When a stroke occurs, particularly when it affects areas of the brain responsible for controlling movement, the person may experience seizures without any prior warning signs. A seizure can last anywhere from a few seconds to several minutes. After the seizure, the person often feels extremely tired, disoriented, and sometimes unconscious for a short period. When you notice signs of a seizure, the most important thing is not to try to stop the person from moving or attempt to control the seizure with your hands. This can cause harm to the person. Instead, Place the individual in a safe position to prevent them from hitting hard surfaces or falling out of bed, and avoid any risk of suffocation during the seizure. If possible, place a soft cloth or towel under their head to protect it from impact. Most importantly, never put your hands in the person's mouth while they are seizing, as this could lead to them biting their tongue or injury to the person trying to help. Once the seizure is over, monitor the person and check if they are recovering quickly. Sometimes, after a seizure, the individual may not remember what happened or feel very fatigued. In this case, keep them in a safe place and continue to monitor their health. If the person experiences a seizure lasting more than 5 minutes, or if seizures repeat without stopping, call emergency services immediately. This is a dangerous condition that can lead to severe brain damage if not treated promptly. Remember, seizures are a clear sign of a stroke. If you notice this symptom, do not hesitate to call for help and provide the doctor with all the relevant information about prior symptoms. The earlier the condition is identified and treated, the better the chance for the patient to recover. 10. Fainting or coma. When an elderly person experiences a stroke, one of the most serious and concerning signs is the sudden onset of fainting or going into a coma. These are emergency situations that require immediate action. Fainting occurs when a person loses consciousness for a brief period and then regains it shortly after. However, this condition does not always provide any warning and can happen without any clear cause. If an elderly person suddenly collapses while standing or sitting without any apparent reason, it may be a sign of a stroke. They will lose control of their body, unable to recognize their surroundings or respond to external stimuli. In the case of a coma, the loss of consciousness lasts much longer than fainting. The person not only cannot react to their environment but also remains unconscious despite strong stimuli, such as being called by name, shaken, or loud noises. A coma is typically a sign of a serious stroke, where there may be significant damage to the brain. When an elderly person goes into a coma due to a stroke, it can impact vital bodily functions. Prolonged unconsciousness may lead to oxygen deprivation, causing damage to brain cells, which could result in long-term effects such as memory loss, inability to communicate, or mobility issues. If not treated promptly, this condition can be fatal or leave severe long-term consequences. If you notice an elderly person fainting or slipping into a coma, the most important thing is to stay calm. You need to quickly call emergency services so they can be transported to a hospital and receive medical attention. While waiting for professional help, you can perform basic first aid measures, such as checking the person's pulse and breathing, ensuring their airway is clear and unobstructed. If necessary, you may need to perform CPR or chest compressions if the person is not breathing. Never take fainting or coma lightly, even if the person regains consciousness shortly after. These symptoms may be signs of a serious health issue and should be evaluated immediately. Remember, strokes can happen suddenly and dangerously, especially in the elderly. To ensure your loved one's safety, early identification of stroke symptoms will allow you to respond quickly and effectively, preventing potentially severe consequences. Dear viewers, stroke is one of the most dangerous diseases that can occur suddenly and have serious consequences, especially for the elderly. Recognizing and detecting the early signs of a stroke will help us take prompt action, potentially saving the lives of our loved ones or minimizing the long-term effects caused by a stroke. Signs such as sudden weakness on one side of the body, slurred speech, drooping mouth, or loss of balance are not only clear symptoms of a stroke, but also serve as warning signs that we must listen to. If our loved ones experience any of these symptoms, do not hesitate. Call emergency services immediately. The sooner the stroke is detected, the higher the chances of recovery and the less severe the impact of the stroke. Do not let ignorance or delay lead to unnecessary consequences. Every precious second can make the difference between saving a life and losing the opportunity for recovery. Therefore, always pay attention to the health of the elderly around you. Preventing and detecting stroke early is not a difficult task. It simply requires us to be patient and attentive to warning signs. Thank you for watching today's video. If you found this information useful, please don't forget to like, share, and subscribe to the Health 999 channel for the latest health knowledge. Wishing everyone good health, and see you in the next video.